We're here at Canadian Footwear, where Leona Chaskey will be meeting with a certified podorthist, Brian Sharfstein, to talk about foot health.
Brian. Come on in and have a seat right in the chair here.
Okay.
How are you?
Well, I'm fine.
Good.
How are you?
I'm good. First of all, I want you to know what I am is a podorthist. Your doctor has referred you to me because you have diabetes.
Yes.
And I'm like a foot pharmacist. I'm here to take a look at your feet. And the doctor has requested that I provide you with shoes and possibly insoles to keep you out of trouble.
Okay.
So we're going to talk about a few things to do with your diabetes and your feet.
Okay.
Okay? So a couple of important things to discuss to begin with. I need to understand what your daily activities are like. I need to understand, do you work?
Yes, I do.
Okay, tell me about your work.
I work at a receiving home. It's
Okay.
one big Korea receiving home. And one of my main jobs there, I guess, is cook.
Okay, so what you're telling me is you're on your feet all day.
Oh, yes, I am. Yeah.
Okay, you're an active and you're a busy person.
Yes.
And then how are your blood sugar levels?
Well, they could be lower than what they are now.
Okay, and are they fairly steady?
Yes.
Okay, okay. I'm going to look at your feet, okay? And then I'm going to watch you stand, and we're going to watch you walk. And what I'm looking for is just seeing, now if I hurt you, you tell me, but what I'm looking to see is to make sure that the skin is not scaly and dry. When your skin starts to get cracked and dry, that's part of the diabetes.
Oh, I see.
Okay, that's very important to understand. Also, I take a look, and there's not a lot of hair growth on your toes. Have you ever had hair on the toes at all?
No.
Okay, because that's another common sign is when the skin gets very shiny and there's no hair growth, we're concerned about circulation coming through to the feet. When you're in bed at night, do you ever get cramping or tightness in your legs?
I do sometimes. Yeah.
Sometimes. Well, that's important to know that's part of the diabetes.
Oh, okay.
Okay. And your toenails? Who does your toenails for you?
I do.
You do. You do a pretty good job, but I would have to tell you that you're cutting them too short.
Oh.
Okay?
This one here,
Yes?
the nail came off here. halfway
Okay.
There. So
But
that's
still,
why
I can see you're cutting them extremely short, almost to the quick. If you,
okay.
because you're at risk sometimes in cutting off a corner or a little piece, and that can be the beginning of a problem. Your feet are in pretty good shape. There's not too many calluses, and you put good moisturizer on your feet?
Yes, I use a moisturizer.
Yeah, every day?
Yeah.
And do you put it between the toes?
No, not usually.
Good, good, and that's important. And there seems to be fairly good movement in the toes. So that one doesn't look bad. Let's look at the other one as well. And it's important as well, when you go to see your doctor, you need to take off both your shoes and socks and show your doctor both of your feet.
Oh, okay.
Okay? Because you have diabetes, it's very important that somebody look at your feet every time you have a medical exam. Because what we're looking for is if there's any spots, you need to look at them every day. How is the feeling on those feet? Pretty good?
Yeah.
So you can feel everything, because quite often people can't feel, and that was one of the things that you have to be very, very concerned about over time. Okay? Well, we're going to watch you stand and we're going to watch you walk. And I can tell by looking at you standing and walking whether I think you will have a problem.
Oh, really?
Okay? Okay? And stand as though I was going to tell you to stand there for an hour. Just get comfortable. How would you keep your feet like that if you were going to stand for an hour? Or you'd move them up? That's better.
Probably like
Okay,
this.
that's good. Okay. And so your arches look pretty good. I want you to take my hand, just for balance, and see if you can go up on your toes. Can you go up on your toes? No problem?
No.
Okay, go down. I want you to take the left foot off the ground, right off the ground, and see if you can go up on your toes on your right foot. Can you go up slowly? Give it a try. And down. That's good. Now what I want you to do is take your right foot off the ground, and I want you to see if you can go up on your left toes. Can you see if you can get that heel up and down? Okay, that's terrific. Now I want you to turn around and I want you to face the chair. When I asked you to go up on your toes, what I was doing was I was checking a muscle that's deep inside the leg. And from the injury you had, if you had ruptured that muscle or if you have damage, you wouldn't be able to go up on your toes. The fact that you can go up on those toes tells me that those legs are in good shape. Now when you're walking, you seem to, on that right foot, you walk out a little bit, you can see in the mirror, your toes point outwards just a little bit. And you do that because of the ankle problem that you have. Should you require a special insole, and we may do one of those because the doctor's requested it, what we'll do is we'll make a mold of your foot.
Oh, yeah.
And from that mold of your foot, what we'll end up with is an insole that will go inside your shoes.
Oh, yeah.
So we will recommend somebody to do foot care for you. And if you have any questions, you can call us at any time.
Sure.
Okay, thank you.
Thank you.
Coming up next on Vitality, we're heading over here to the exercise studio. So make sure you go put on some comfortable clothes and some good shoes because we're getting moving right after the next break.